Hair color in pregnancy, is it safe or not? Generally, the chemicals which are used for hair coloring are quite harmful, but still the quantities which are used for hair color is very small, and so they do not cause any complications in the newborn. There are a lot of studies done in this regard. One study showed an increased incidence of low birth weight babies in people who used pre-pregnancy hair dye, and also there was an increased incidence of allergic rhinitis and asthma in 3-year-old children whose moms were exposed to hair treatments during pregnancy. Also, there was a little higher incidence of childhood tumors, but this particular study had other risk factors which was confounding, so this study is not to be taken into account. Based on the above studies, we can conclude that hair dye is quite safe during pregnancy, but done with proper precaution. Precautions to be followed during hair dye usage in pregnancy: number 1, do it in a well ventilated salon so that the air circulation is good. Number 2, leave the hair dye on only for the minimum prescribed time. Number 3, rinse the scalp immediately after the application time is over. Number 4, avoid doing hair dye when there is any scalp injury or any psoriasis or any other scalp irritation. Number 5, limit the sessions only to 2 to 3 during the entire course of pregnancy, and also avoid during the first trimester of pregnancy. Number 6, avoid root coverage and try to do highlights, which is better because the absorption of the chemical lesser when you do highlights. For salon workers and hairdressers, try to do your work in a well ventilated area and limit the exposure time by limiting your work hours to less than 40 hours per week, and do not eat or drink in the same environment where you work, and always use gloves and masks while you handle hair treatment.